Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're announcing 9 new cases of COVID-19, bringing our total to 203. The total number of deaths related to COVID-19 in Manitoba remains at 2. As of this morning, 11 individuals are hospitalized. Of that, 7 are in intensive care. We are reporting 17 individuals listed as recovered. Public health investigations continue to confirm details, and information will be provided on our website as that information is received. Yesterday, 488 tests were completed at CADM Provincial Lab, bringing our total to 12,998. I again thank the CADM Provincial Lab team for their hard work and dedication, bringing down the backlog of tests and now working on a test turnaround time of 24 to 48 hours. So thank you again for your hard work. Work continues to ensure that all those who have been tested receive results in an expedited manner. I have an update today on the investigation of a respiratory illness at Bedell Home in Gimli. Yesterday we announced that the testing of the 9 residents showed 0 COVID cases in the residence. We can further provide information that the presumptive positive test on the healthcare worker in fact was a false positive test and is not considered a COVID-19 case. We are continuing to ask Manitobans to take significant precautions against COVID-19. Our social distancing messages have increased over time and can be challenging to many Manitobans. But we know this is necessary right now to interrupt the transmission of this virus. We see increasing numbers of cases in our province. We're seeing evidence of early community-based transmission, and unfortunately we've been seeing severe outcomes. So now is the time for all Manitobans to act. Stay home whenever you can. Only go out for essentials. If you have to go out, practice social distancing strategies at all times. This messaging also applies to family get-togethers, especially around holiday time. You know, there will be a time when we can have these get-togethers again. This is not that time. I discourage family get-togethers even during the holidays. Now is the time to stay home. We know there has been evidence of a virus being transmitted at such events in other jurisdictions, and so we really are asking Manitobans, stay home as much as you can. Only go out for essentials. And so this would include staying home instead of getting together in large family gatherings. That being said, ensure we're staying connected with each other. Social distancing is not social isolation. Make sure we're reaching out to our friends and family and loved ones. Make sure we're staying connected. But we have to adhere to the social distancing strategies at all times. These social distancing strategies apply anywhere in Manitoba. If you are aware of a case nearby you, ensure you are practicing social distancing, staying home as much as you can. If you don't believe there's a case around you, stay home as much as you can and practice social distancing at all times. This is to all regions in Manitoba. It's essential that we all work together to interrupt the transmission of this virus. One of the most important things is to stay home if you're sick. Do not go to work if you're sick. Wash your hands frequently. Practice social distancing at all times. If you have questions and are ill, feel free to call Health Links for further advice regarding testing. Continue to look to credible information during these difficult times. Our website, manitoba.ca COVID-19, provides up-to-date information on this virus. I encourage people to go to that frequently. We've mentioned that the University of Manitoba continues with a clinical trial on a potential treatment for COVID-19. And so those who are confirmed cases, those who are contacts to confirm cases, or healthcare workers who are contacts to confirm cases, can go to covid-19research.ca for additional details. We have all of these implementation strategies regarding social distancing in place. There's public health orders in place, and these are challenging times. They're putting a lot of burden on Manitobans, and we appreciate everyone's effort. But all of these efforts are here because we are not helpless against this virus. Together, we can interrupt the transmission of this virus, but we have to work together, all of us. Do not wait for an order to apply to you. Act now. Stay home. If you go out, only for essentials. Practice social distancing at all times. Keep that 2-meter separation between you and others at all times. Wash your hands very frequently, and we will interrupt this virus and flatten our curve. Thank you.
Thank you. Good afternoon. I wanted to start today by acknowledging the efforts of so many Manitobans that are giving back to the community in a variety of ways. We've seen a number of thoughtful initiatives launched over the past 3 weeks, and it's been amazing. So there have been companies who have switched gears and changed what they do so that they can now produce medical supplies and apparel for our healthcare workers to help us face this challenge. Canada Goose being one of them, we're very appreciative of. There are municipalities going above and beyond to help its residents. In the rural municipality of Pipestone, they set up a grocery delivery service for its residents and offered interest-free loans to local businesses to help keep them afloat. And there are small gestures that we've heard and seen so much. People donating blood, giving to charities, picking up groceries for elderly neighbors, and putting artwork on their front windows to try and brighten people's day during these times. In Manitoba, when we say we're all in this together, it's not just a tagline. It's really how we've chosen to live our lives these last few weeks. And it's great to see. So thanks to everyone who continue to bring that energy to this unprecedented time. I also wanted to give you an update on the COVID-19 Case Contact Center. So we announced this last week that we were going to establish a centralized center where people could work together to make sure that those who are diagnosed with positive COVID-19 and their contacts, there's a concentrated effort happening to do that work. So as Dr. Roussin has said before, there's a lot of follow-up that's required in this. All the contacts and the positive cases have to have daily surveillance and making sure that they're not developing symptoms and helping to troubleshoot if they're having challenges with self-isolating. So this past week, we have staffed them up, ordered them what they need in terms of supplies to get to work. So we now have 30 students from the University of Manitoba College of Medicine providing support to this call center. And these are medical residents who have been trained to be clinical providers under the supervision of residents. We also have 50 more students and residents that have offered to help. So training is ongoing and happening as I speak, and we anticipate the center will be up and running by midweek. And I also wanted to speak about virtual care and remind Manitobans that the valuable healthcare services that we provide will continue to be provided, but albeit in a bit of a different way with some modifications. So Doctors Manitoba has agreed to offer virtual visits and virtual psychotherapy options to supplement traditional models of care, including video conferencing options. And this is being done wherever possible to reduce the chances of spreading COVID-19. For example, clinicians are providing a range of mental health services that are either over the phone or using video. And across this system, the virtual and phone services have proven to be a successful method in providing care during this unique time. There were 2,287 virtual visits to physicians in the past 3 weeks after we had the first case of COVID-19 reported in Manitoba. And in that same time period, there were also 3,484 text appointments for consultation between physicians. So, of course, there always will be those times where in-person visit is necessary and needed. And, of course, in those situations, we will make that happen. Proper precautions will need to be taken into account to minimize risks. So that would include staggering appointments whenever possible and ensuring social distancing strategies are used. But wherever possible, virtual and telephone services are a key way to continue to provide services for patients during this time. So that's it for me, and we can open it up to questions.
Thank you. Each reporter will get a primary question and one follow-up, and reporters are reminded to please introduce yourselves. From the CBC Manitoba, Holly.
Hi there, Holly Carrick here. Question for Dr. Roussin, just in regards to the shared health policy that is allowing the potentially exposed healthcare workers to return to work before the end of the 14-day isolation. Can you just explain if this policy makes sense or why it's okay for them to go back to work?
Yeah, so this is, we're looking at the number of exposures. Most of the exposures that take place in a health facility are not close and prolonged contacts. The contact tracing is wide and vast, so a number of healthcare workers can be affected. However, when we move to those individuals using continuous universal protective equipment, then it becomes less important to ensure that they self-isolate for 14 days. If we monitor symptoms, they're wearing PPE at all times, then it's the risk is greatly reduced in there. So if we have a healthcare worker that we feel has not had a largely significant exposure, and we can get them back with universal continuous personal protective equipment, then we've managed to address some of the capacity issues as well as continue to protect clients.
Thank you.
From the Winnipeg Sun, James.
James with the Winnipeg Sun, thank you. In terms of flattening the curve, is there an estimate in terms of how Manitoba is doing compared with other provinces like BC and Ontario?
Yeah, so Manitoba is quite a bit behind those provinces in our curve, so it's difficult to compare at this point. Those BC, Ontario had cases at the end of January. Ours first case was March 12th, so it's a bit early to compare. And certainly things like the case numbers and severity are in the early estimates and are comparable to other jurisdictions in Canada at this point. But we'll have to continue to monitor closely our epidemiology, and we're working on things like modeling at this point. But like I say, we're quite a bit behind those other jurisdictions in the course of the outbreak.
Thank you very much.
From CBC Radio Canada, Ezra.
Hi, Ezra Cousineau from Radio Canada. Nice to speak to you. Last Friday, I talked about, I mentioned the case of that nursing home, Action Marguerite in Saint-Vital. The nursing home sent an email and posted on their website that one of the employees that wasn't in the direct contact has tested positive to COVID-19. And at that time, Friday, you told me that you didn't receive any report concerning that specific case. I wanted to know if you finally got a response and if you are in contact with that nursing home.
Yeah, so we don't know of a worker within that home did test positive for COVID-19. There were 3 other workers that were tested. They all tested negative, and we're not aware of any ill clients at this point. So all precautions are taken, but there's no ill clients, and no other employees have tested positive.
Okay, thanks. For my follow-up, this morning, today, the Canadian Union of Public Employees sent a news release talking about a letter that has been sent to our Mr. Cameron Roussin. And I just want to read to you a part. It's a declaration from Christine Lucier, who is the president of CUPE 8600, which represents home care workers in the Northern Regional Health Authority. And I would like to know, what is your answer to that statement? I start. The lack of PPE for home care workers is yet another indignity that home care workers have been forced to endure from a healthcare system and government that continues to treat them as a second class, said Christine Lucier. What would be your answer to that statement, please?
Well, we have guidelines for home care. We have screening protocols before they go in the room or go into a client's home, and we are distributing supplies. So if there's some disconnect there between the worker and the PPE, I think it needs to be raised to the leadership, the management, so that we can understand where the problem is. But I would say on behalf of Shared Health and Manitoba Health, every worker is important to us, and we have considered what is required to keep them safe. So I would be interested to follow up more on that, because they shouldn't be feeling unsafe. They shouldn't be feeling like they don't have what they need to provide care.
Okay, thank you for your answer. Thank you.
From CTV Winnipeg, Jeremy.
Hi there, Jeremy Sherrill from CTV Winnipeg. My first question, we received some information. Seven Oaks Hospital received a patient who is COVID-19 positive, but we're not equipped to handle that type of patient. I'm wondering, are you able to confirm that, and are only certain hospitals able to handle these types of patients? And should a patient who has COVID-19 been going to the hospital, or should they have been staying home in self-isolation?
So every individual case is going to be different. From what we understand from other jurisdictions, most COVID-19 positive patients will have mild symptoms like a flu and be okay to stay home and have regular follow-up with their public health provider. But there are cases, of course, where people are have chronic disease or symptoms change. So all hospitals are capable of providing care to an average medical patient. There's suction, there's oxygen, there's talented, skilled people with the equipment. But if a patient does require the hospital, it's really up to those individual hospitals to determine what are the needs of the patients and can they be met at that specific facility. And sometimes they can. And sometimes the patient may need more, and if it's critical care facilities that they need, then they would be transferred to the right place. That doesn't mean everyone has to go to the site with critical care. It means the system has to work together to make sure that the patients are safe wherever they are, at home, at a facility, or in a highly acute center.
Thank you. And my follow-up question is in regards to parking at hospitals and healthcare facilities across the province. We're hearing from some nurses and people who have been spending a lot of time at hospitals that are getting tickets or having their vehicles towed. We've seen other provinces, Alberta, Saskatchewan, BC, have all taken measures to make parking free at hospitals, or to temporarily remove paid parking for doctors, staff, and visitors. Is that something you guys are considering, maybe providing that relief for specifically nurses, healthcare workers that probably don't have the time to maybe feed the meter or whatever, and at the end of their 12, 14-hour shift are having to go out and find their car towed or something like that? Are you guys looking at taking precautions or taking measures to stop that?
Yes, there definitely is consideration and work being done to explore that. And we would like to make it as easy as possible for nurses. So we can give you an update on that soon.
Okay, so can we expect to hear soon that maybe parking will be free at hospitals across the province?
I will give you an update on where that's at because I've seen communication on it, but I don't know that it's come through our incident command quite yet, but we will follow up.
Okay, fair enough. Thank you.
Thank you.
From the Winnipeg Free Press, Julia.
Hi, this is Julia Snownutters from the Winnipeg Free Press. We've heard that PPE is in short supply around the country right now, and I understand that Canada is to get a shipment of masks and other PPE on Monday. Can you give a sense of how much of that shipment Manitoba could be getting, or what the PPE shortage looks like in this province in particular?
Yeah, we have our logistics team looking at, we are expecting more shipment tomorrow. We're hoping that we get everything that we ordered, and we are doing an assessment, a bigger assessment than what we've previously been working with. So really looking at all service delivery, whether it's justice or families or private physicians, private clinics, and the healthcare system. So we're doing a real thorough review right now to say what do we need to come in and what's going out, and so we should have more detail on the logistics situation tomorrow. I know they've been working all weekend on it. We are in an okay state right now, but obviously that's depending on that our vendors and the supply chain keeps moving. So once we get more information, we can share that.
Awesome, thank you. And a follow-up, as we do receive more PPE, do you have a sense of who would be prioritized in terms of receiving that? We've heard from home care workers and private long-term care facilities that they're seeing intense shortages of PPE. So just wondering about the prioritization there.
Yeah, and that keeps coming up, so we're going to have to look at why there's a problem getting the PPE to the people. It may be because they're a mobile group and they're not necessarily stationed where all the supplies are, so we're going to have to work through the logistics of that, but we certainly want them to have. The other issue is that as public orders are coming and staff are being moved to different priorities, there's a lot of shifting sands right now in the healthcare system, so we're trying to manage all that, make sure that service is happening and staff are getting everything that they need. So it'll be ongoing throughout this whole pandemic. We'll be making sure that the PPE matches the staff and the staff match the service needs.
Thank you so much.
Thank you.
From the Global, Eric.
Good morning. This is Eric from Global. I'm wondering if you can explain the difference between the severity of patients who are either hospitalized or in the ICU. For example, say a patient is hospitalized, are they under observation and perhaps receiving oxygen, whereas somebody in the ICU has been intubated and is placed on a ventilator? I'm just wondering what the difference there is.
Yeah, no, that's a really good question. So a patient who can stay home is obviously a patient who can manage the symptoms themselves, whether it's a fever or a cough. So they can manage and self-isolate. Patients who have to go in the hospital are usually, they need more observation or more intervention. So exactly like they may need some oxygen, that's usually the most common thing. But they may also have underlying health issues like diabetes or chronic obstructive pulmonary disease. So there's a lot of systems in your body that are maybe affected. So there's just more closer monitoring and managing of the symptoms. And then, yes, the critical care patient, which is a small number of the population, but that is where they need a very special skill set, medications, maybe other systems in the body, like the heart, are starting to get impacted. So there's EKG monitors and obviously intubation if they need support with breathing. So it's just really levels of degrees.
Excellent, thank you. And then for my follow-up, a question from my news desk. Can you tell us where the isolation centers that were announced yesterday are?
No, I cannot at this time.
That's okay, I appreciate it.
Thank you.
From the Brandon Sun, Kyle.
Hi, this is Kyle Robertson from the Brandon Sun. I was just wondering about something. Yesterday, I believe that you guys reported that there were 12 cases of COVID-19 in the Prairie Mountain Health Region, and today on the website it says there are 11. So could you kind of explain how that came about exactly?
Yeah, I don't know the specifics on there, but this is all about the public health investigation. So we'll get the reports, and we'll have, say, a person's address on the requisition, and then so we'll report it out as their place of residence. After public health investigation, they could learn that this person no longer resides in that region, and then we would adjust our numbers.
Okay, so it's potentially just kind of a logistical kind of error where they have a wrong address reported?
That's right, yep. So that's the, as we try to get our numbers out as quick as we can, there will be changes to this as public health investigates, and then sometimes there'll be a redistribution amongst the regions due to things just like somebody's health card wasn't up to date or something like this.
Okay, so the grand total of cases isn't changed, it's just that that one case went to another health region.
That's correct. Yeah, that's not the
grand total of the ones in Manitoba. Yeah, okay.
Right.
Great, thank you.
All right, we have time for one more round of questions. One question each reporter, please. So back to CBC Manitoba and Holly.
Hi there, Holly Carrick, CBC. Just wondering, so Manitoba's cases of COVID are doubling, it seems, every 4 days. What needs to be done now that we aren't already doing in order to flatten the curve? Is there more that we should be doing?
Yeah, so these interventions that we put in place, the escalation of the public health orders just took place a few days ago, just on Wednesday. And so the cases that we're seeing now were likely exposed, a week to 10 days ago. So we still haven't seen the benefit of the escalated measures as of yet. So we're going to continue to follow that and make changes as necessary.
Thank you.
From the Winnipeg Sun, James. Okay, from the CBC Radio Canada, Ezra.
Hi, Ezra Belot-Kuznos from Radio-Canada. I wanted to know about the alternative isolation center. You said that they were opening this weekend, so I guess today. And I wanted to know if are they open? Can we know now which hotel is it? And how things are going.
Oh, thank you for asking. So we're not releasing the name of the hotel at this point in time, and this weekend was a soft launch. So our staff aren't officially starting till Monday, but we had screened several healthcare workers and admitted the first one yesterday, actually. Just made sure that we had the pathway through the hotel right, and the handoff of personal protective equipment, and made sure everything everybody was comfortable with the setup, and we're meeting more today about the intake process, and so we'll continue to gradually build up over the next week. But tomorrow the staff come and we'll build capacity as we go. But it went really well. I think I did talk to the healthcare worker who is in the hotel last night, and she was feeling very relieved and comfortable to have that space away from her loved ones that she was worried about. And yeah, she was good.
Okay, thank you. Can you just repeat? Maybe it's my English. I'm sorry. I think I didn't get it wrong. Good. Can you say how many people are there, residents, and how many health workers are on place right now?
Not at this time. We're not going to confirm the numbers, but we will give a report once we get up and running.
Okay, thank you so much. Have a nice day.
Thanks, Ezra.
From CTV Winnipeg, Jeremy.
Hi there, Jeremy from CTV Winnipeg. I'm wondering, the Manitoba Nurses Union and Manitoba Association of Healthcare Professionals has released a joint statement in response to Minister Cameron Freeze's comments about nurses who are having to use, or any healthcare workers that are having to use sick days when being sent home in self-isolation. I'm wondering if you can provide any further comment on that and on the fact that the union and healthcare workers are quite frustrated with that being the situation.
Yeah, well, I guess that is discussions those are discussions that happened early on in the planning process. So I think it was January and February, we were having those conversations about what do we do when a healthcare worker gets sick. And I guess on principle, that is what income protection is for. So sick time, there's other bank time as well. So yeah, it's a decision really that has to happen at tables with HR and the unions, and if there's a solution, I assume they would work towards that. But that is my understanding is what has been the past protocol in other situations. It was planned early on in this process, and if we're going to change it, I would leave it to the powers that be to make that happen.
Thanks so much.
Thank you.
From the Winnipeg Free Press, Julia.
Hi there, it's Julia from Records from the Winnipeg Free Press. We got a report today that Canada's public health chief says hospitals should not be throwing away used masks and other protective equipment because there's a plan to look into disinfecting and reusing those. Will Manitoba be directing hospitals not to throw away protective equipment and following suit in that research?
Yesterday we announced N95 masks would be, if they were clean or gently used, we would look at reprocessing those. We haven't gone to the general mask, gowns, and gloves, but I'm sure that's something that people would be considering if that's the recommendation of Dr. Tam.
Okay, perfect. Thank you.
Thanks.
From Global, Eric.
My apologies. This is from Global. My apologies. This has already been answered, but I can't recall viewing it and nor seeing it in my appropriate background research. I recall a few weeks ago there were a number of ventilators that have been, or rather there have been an order placed for a number of ventilators. Has Manitoba received more ventilators in the time between that?
I'm just going back to my notes. I don't know when the last update you have was. I'll have to get back to you on that because I think they have been getting their ventilator orders, but I don't have a grand tally for you right now. I can check. It's a moving number and always moving in the right direction, though.
Of course. I'll email Paul. Thank you.
Thanks.
From the Brandon Sun, Kyle.
Hi, this is Kyle Darbison from the Brandon Sun. On Saturday, you guys mentioned that there are plans in place to establish a isolation site in Brandon. I was wondering if you had any more information about that site, like when it would be set up, and any other details.
Yeah, that's a great question. It's really important to us in this whole COVID-19 pandemic planning that we take a provincial approach to responding and making sure that all patients in Manitoba have a safe place to go. So we are looking outside of Winnipeg, and Brandon is one site we will be looking at. Right now, we are going to start in Winnipeg because this is where the highest volume of COVID positive patients. We're going to work through the process, and then we will take it on the road after that and just replicate and keep building capacity as we go so that everyone has an opportunity for isolation. And we're very much want everybody to be able to just take the plan and take the process and make it happen. And we do, our RFP does include space outside of Winnipeg, hotel space outside of Winnipeg. So very soon.
So as of right, so as of right now, there's no specific date on when that would be established, though.
No, not at this point.
Okay.
I would say as soon as we feel comfortable that we've got this first site, we've worked out all the kinks and we've got that process really slick and steady, then we're going to take it out beyond. So I would hope in a couple of weeks, perhaps.
Okay, great. Thank you so much.
Thank you.
All right, we have time for a couple more questions. Any reporters have one more question?
I do, actually. It's Holly Carrick, CBC. Just in regards to the recovered cases, are any of those prior ICU patients or people who were hospitalized?
Yeah, I don't have that information on there. We were hoping to be able to provide those updates as they come in. A specific mention of a recovered client, say like you say, if they were in hospital or ICU. At this point, I don't have that information.
Okay, thank you.
Anyone else?
Oh, sorry, it's Fred Bill from the Winnipeg Sun. I think James left the call. I was just wondering, if I can ask, just wondering, if the test numbers have gone down or have fluctuated a lot lower lately. Is there a reason for that, or is it just less testing right now?
Yeah, there's lots of reasons. The test volumes could be one of it. The lab, when they're getting numbers back at 1,200, 1,300 in a day, that's really at large over their typical capacity. So certain times they won't be able to manage to keep those type of numbers up. So overall, we expect the numbers on average to be quite a bit higher than they have been. But there may be days where we see lower numbers for various reasons.
Thank you.
Thank you. That concludes today's media briefing.
Thanks, everyone.